here are the top 10 reasons why you should not have a hair transplant surgery. Stay tuned. We're going to talk about that. Hi, welcome back to the channel. Hope you're doing great today. So today's video is about the top 10 reasons why you should not consider having a hair transplant procedure. I've been doing hair transplants for over 20 years now, and there are some patients who just are not good candidates for it, should not have them. These are not medical reasons, but these are just reasons that you should think about very hard, and then if you classify as one of them, maybe this is not the right thing for you, okay? So again, the top 10 reasons why you should have a hair transplant procedure. Number 10, if you don't mind being bald. So some people don't care about being bald, so what's the point of going through a procedure to replace the hair they've lost if you don't care about how you look? There's a lot of people out there that have hair loss and they look great, they feel great, that doesn't really bother them. So if that's the case, don't bother with it, don't do anything about it. Number 9, if you're doing it to please someone else. I've had plenty of patients in the years that I've been doing this that they came to me and said, well, I don't really care about my hair loss. My wife is the one that's insisting me to have this done because she thinks that I look older, and she doesn't think I'm as attractive anymore, and so I'm doing this for her or for any other reason. Well, I usually tell them, look, if you should only go through this if you care about it, right? Because life changes. You don't know if you're going to be with that person forever or not. Hopefully you will. But at the end of the day, this is a procedure that can get you really nice results, no question about it. But it involves, a procedure. It involves some money, obviously. So it's something that you should do for yourself if it bothers you. If it bothers other people, then you have nothing to do with that, right? So, if you look in the mirror every day and you don't like what you see, that's the reason they should do it, but not for somebody else, not to please another person. Number 8, if you like shaving your head. So a lot of guys now shave their heads. They have a nicely shaped skull. They look good bald with a shaved head. So what's the point of doing a transplant? You're only going to have some scarring there that may prevent you from shaving your head like that with a razor or take it down to the skin level. So if you like to shave your head, if you've done it for years and you don't mind and you look good, you think, so no reason to have a hair transplant. Keep shaving it. Number 7, you were told that all you'll ever need is one transplant for the rest of your life. That's something that I hear sometimes from patients that went to other consultations and they were told, yeah, just do the one transplant and you're going to have a full head of hair and you're not going to have to do anything else. That's not true. You have to understand that transplants it's a process, right? We are replacing the hairs you've lost. We're not really treating hair loss by doing transplants. And so you need to understand that that's usually not a one and done. Number 6, you expect to have the hair that you had when you were 18 years old, so full head of hair before you lost any hair. Not really achievable with transplants. For that, if that's your goal, you should be looking into a hair piece or a wig of some sort, because they can give you unlimited density of hair. Transplants are great and they look really nice, but you're going to see some spaces in between. You're going to see some thinning. Usually I tell patients, look, you're going to come from where you are now with your hair loss to maybe when you started thinning your hair. So you're still going to see some spaces. When it gets wet, you're still going to see a little bit of see-through transparency, but of course it's going to be a lot better than what it is. But if you're only going to be happy by having the head of hair you had before you lost it, you may not be a good candidate because you may be disappointed. Number 5, if you did not see a doctor for your hair loss consultation. I'm going to refer you again to a video that we recorded on consultations. I'm going to put the link right up here for you. It's very important that you see a qualified professional that has experience in hair loss and hair restoration, because not all hair loss is treatable with a transplant. Many types of hair loss are not, and so you owe it to yourself to at least see a specialist. Okay? If you see anybody else but a doctor, don't believe it. Number 4, if you have inflamed areas or itchy areas in your scalp, or if you have patchy hair loss. Those are probably other types of hair and skin conditions that may not be best suited for a hair transplant procedure. You need to treat them medically, but you need a diagnosis that's correct. So if you have these symptoms, think about it before you have a hair transplant procedure. Go figure out what you have first and treat it, because the hair transplant may be the wrong thing to do. Number 3, if you were not counseled about medical therapy to stop your hair loss. I can replace hair on your head by moving hair from the back, the permanent hair zones, into the areas where you thinned. But if you continue to lose your native hair or the hair that's on your head right now, I'm not doing you a favor if I don't talk about preservation of those hairs. Transplanted hairs don't need any treatment. They should grow without anything because they are resistant to the hormone that makes us lose our hair. I'm talking about genetic type of hair loss for men and women. I'm not talking about any other types of hair loss, but that's the most common that we see is the genetic type of hair loss for men and women. So for those treatments, transplants will grow and they won't need any therapy. But I have a very strong proposition for you to maintain your hair. I don't like to allow you to lose the rest of your hair because it'll only be worse and we're going to have to face more transplants. So if we can control your loss with medications, nowadays there are treatments that are very effective. We're going to record a video about that so you can reference. It's the best thing to do. Preserve your hair as we replace it. Number two, if your hair loss is progressing rapidly. So if you're looking at pictures every year for, like Christmas pictures or holiday pictures, for example, and every year you see that you look a lot thinner, might not be a good idea to do the surgery at that point before you stabilize your hair loss with medications, perhaps. So why is that? Because if you transplant while you're actively losing hair very fast, you're going to be chasing this and you may not ever reach your goal. So the best thing, what I recommend my patients to do is to stabilize their loss first and then go through the transplant if needed. And numero uno, the first reason why you should not have a hair transplant procedure is if you're young. Now, the word young means usually early to mid-20s. Okay, certainly if you're a teenager having hair loss, and I know there's a lot of you out there that are experiencing that, you need to talk to me or to somebody and get into medical therapy to preserve your hair and stop your loss. If you are very, very young, like I said, early to mid-20s, hair transplant procedure may not be the best option for you at this point. We want to kind of see where your hair loss is going to go. We want to have an idea, and we want to make sure that you can treat with medical therapy so that we can have a more stable ground to walk on as we venture into transplants. What happens sometimes if you transplant someone very young and they continue to lose hair, or for some reason they can't take the therapy and they keep losing, we're not going to have enough hair on your head to treat the progression of your hair loss. So it's always best to sort of delay the transplant until you're stable on therapy, until you get a little older. It doesn't mean you have to sit around and not do anything about it. Like I said, we can treat it medically so we can stop it or maybe even improve your hair. And then when you're a little older, when the hair loss is more predictable or more stable, we can go for it. So in conclusion, if you are not sure if you're going to have a hair transplant, if you're a great candidate for it or not, if you looked at all these reasons that we presented here not to have it and you don't fit in any of them and you're willing to discuss your options, or even if you're not sure, call us for a free consultation. I'll talk to you, no obligation. I'll just give you some advice based on your condition, your situation. I'll also record a video with the top 10 reasons why you should have a hair transplant, and the link is going to be up here for you guys to look at that video. So this is a journey and you have to be careful how you proceed with it. So hopefully this was helpful for you. If I can answer any questions, write the questions in the comments below. Make sure you subscribe to the channel. Make sure that you promote our video to your friends and family if they're interested in hair transplantation. Our goal here is to educate you so you can make the best decision for yourself. I will see you next time. Take care.